I'm a senior, music therapy student, of course. I couldn't think of a good presentation title, so I went with Music Therapy 2, Electric Boogaloo. I don't know why. Let's get started. So the main question, the whole reason I'm up here, what is music therapy? What is that? Most people listen to music when they're sad to feel better, or when they're happy to feel better, or in general to feel better, right? Most people do that. That is very, very close to what I'm trying to be trained to do, but it's not quite exactly that. I'll get into that later, but the American Music Therapy Association, which I will refer to as AMTA because it's a lot shorter, the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. That's a lot. Okay, so is anybody trying to be another kind of therapist, like a physical therapist, recreational therapist, occupational therapist, anything? Okay, so basically each type of therapist has their own tools, right? Physical therapists use movement as a tool, rec therapists use activities, socialization as a tool, and then psychotherapists use conversation and thoughts as a tool. A music therapist basically tries to accomplish the same goals as each of those, but uses music as their main tool. Whatever we can do to apply music to a person's life and make it better, that is our main goal, what we're trying to do. So to be a music therapist, to say I'm an actual music therapist, not just a guy with a guitar, you have to be board certified, just like most professions. And the way you do that is, there's a board certification committee, of course. But the way you do that, you have to have a bachelor's degree in music therapy or an equivalency degree. I have a lot of classmates who are psych majors or education majors or something similar, music performance, music education, that get their music therapy equivalency. After that, you sit for your exam, like I'm sure most of you have to do to become whatever it is you're trying to become. There's always an exam. And then depending on what you want to do, you have to do further training. Most of them are week-long or weekend-long training sessions where you go to classes, you do practicum stuff. For example, if you want to work in the NIC unit, you have to go to a special NIC unit music therapy training program, or if you want to be a neurologic music therapist, an NMT, then you would go to a training. I think that training is about a week long or something like that. So depending on what you're trying to do, you know, if you want to just run a private practice, you could just stop after you take your exam and you're good. Okay, so the next question is, why does this work? I could sit here and talk about this for days, and I'm not going to. This presentation is a really brief overview of what I'm trying to do, but the main question that music therapists ask are, why does music affect people the way it does? You can think about it in terms of brain structure or abstract principles, which is basically whenever you hear music and your body reacts, your brain reacts, fires off those neurons, and for whatever reason, however, in whichever way, is that how music affects you, or is your reaction to that how music affects you? Oh, and this is basically what I said just now. The auditory process is when you hear music and your brain reacts to it, that's automatic. That just happens. You can't really control that unless you totally shut the music out. That's just how it happens. But are your reactions to it? Are your reactions to it automatic? Not always. You can hear a sad song and not get sad. You can hear a happy song and not get happy. And again, these are very basic explanations of what we do as music therapists, but the question that we ask is, how does this person who I'm trying to help, how do they react to music and why? And what can I do to use that to help them in some way is our end goal. And the next question to ask is, what can be done? What can music really do? You know, besides make you feel happy whenever you listen to a happy song or stuff like that. You'd be surprised to learn, if you don't already know, that music can do a whole lot of different things. Sorry, we're just hanging out here. No worries. Yeah, music can do a lot of stuff, a whole lot of stuff. Whenever we approach therapy, whenever we get a client and we look at this client and we see, well, how do they function in each of the domains? If you're trying to be any kind of therapist, then you probably are familiar with the functional domains. The good thing about music is that you can address all of them in some way. The first is cognitive, which is your thinking. You have physical, which is moving. Psychosocial, my personal favorite, which is feeling and reacting. And then speech and language, communicating. And musical. And I started that because musical functioning is not always taken into account. It's basically just, is this person musical or not? And how can they participate musically in a therapy session? Is what we do with that. Now with cognitive, of course, I've brought it up 1,000 times already. You can listen to music and think in a certain way, or think a different way whenever you're listening to a piece of art that affects your brain a certain way. Physically, of course, dancing is the main one. Tapping your foot whenever you hear a song, just even if you never heard it, you can tap your foot to the beat. There are lots of physical reactions, and we can do things like helping people learn to walk correctly again. Or I had a client previously who couldn't lift their arm, but I worked with them, and if they had a musical cue, if they were listening to music, they could lift it just a little bit higher to hit a drum or something like that whenever they get that extra oomph to do it. Psychosocial, like I said, is what I'm most interested in right now. I'm working in a behavioral health facility in Conroe, and it's a temporary stay facility, short term, and basically our job is to socialize them and just give them something to do that's not as structured as their day-to-day life is. But everyone has experienced the psychosocial effects of listening to music. If you haven't, then I recommend you try it. Listen to music. Speech and language is very interesting. I'll show you a video about it later. Whenever you speak, you only activate one side of your brain, right? But when you sing and when you participate in musical activities, you activate both sides. So there are people who can't speak and can't formulate words for whatever reason, yet they can sing, which is absolutely amazing to me. It's just because singing and musical activity, they pull from both sides of your brain rather than walking or talking just on one side. I find that to be very cool. And then, like I said about the musical, basically what we look at with that is how can you participate musically? Can you play instruments? Are you interested in playing instruments, or do you want to just listen? Stuff like that. Okay, and this video is Congresswoman Gabby Giffords. Anybody heard of Gabby Giffords? Congresswoman from Arizona. She was shot in an assassination attempt at a Safeway, I think I read before we started, and she lost most basic abilities. The most important one and the point of the video is the ability to speak. And as a politician, I just got an email. As a politician, you need to talk. It's just one thing you do. And she was very, very personable, very successful in her field, and then it was all taken away. She actually went to Houston. I think it was at Memorial Hermann. She was sent to Houston and worked with music therapists there. And this is just a quick video about her experiences there. Skip to 150 if you could.
Homer, I love you.
1 month after the shooting, Gabby Giffords was in the hospital in Houston, settling in for the long haul.
Good.
I can tell you that rebuilding speech after an injury to the left side of the brain is exhausting, often agonizing work. Before the shooting, she was a dynamic, engaging speaker.
The libertarians and the vegetarians, I want to thank you.
A Fulbright scholar, fluent in Spanish.
Good morning, everyone. Buenos dias.
Now, in those early therapy sessions in Houston,
You turn on the light.
it seemed as though words had abandoned her.
Let's try this one. Watch me. Just turn on the...
For those of us injured on the left side of the brain, our loss of words can make us feel trapped inside our own minds.
Guys, are you frustrated? Can I tell you something? It's gonna get better. Okay? It's frustrating right now, but it is gonna get better. You've come a long way in 5 weeks. Come a long way.
And then, in this emotionally charged moment, to our absolute amazement, we heard this.
Okay? You're gonna do this. You ready? This little light of mine, I'm gonna let it shine.
Remember, at this point, she couldn't say the word light. Suddenly, there she was, singing that word and a whole lot more.
I'm gonna let it shine, let it shine, let it shine, let it shine. Excellent. Well, good morning. Gabby, how do you do?
Megan Morrow is Gabby's music therapist.
Why is it that someone who can't speak can sing?
Because music is accessed in many different areas of the brain that aren't designated for language. We're retrieving pitch, melody, rhythm through all these different areas, and those are working to get your language back.
Remember we told you that language is normally held in the left hemisphere of the brain. Music exists in both hemispheres. Incredibly, scientists are finding that music therapy has the potential to rebuild language on the uninjured right side.
Nothing activates the brain so extensively as music. And it's really only been in the last 5 years that brain imagery, which showed it had been possible to create a new language area in the right hemisphere. And that blew my mind. One would have said there's a fantasy.
Reminds me of being stuck in traffic on the freeway. You aren't able to go forward on that pathway anymore, but you can exit and go around and get to where you need to go.
In therapy, phrases are combined with music.
I am fine. I am fine.
Then gradually, the music fades away and the words can stand on their own.
So what are you gonna tell him? Kiss. Give me a kiss. Right now. Kiss.
Yeah. So that I think is really cool. Just maybe it's just me, but I think it's really cool. And it every time it breaks my heart to see her get so frustrated, because you know that in here she knows what she's trying to do. She knows that she's trying to say the word light. Light is not that hard a word to say, but when that gets taken away from you, the frustration has to be crazy, right? And I'm sure she was working with speech therapists, but a cool story, the first time she spoke, actually, after the shooting, was you heard them singing Girls Just Want to Have Fun. It's her favorite song, and her therapist would just sit there and say, Gabby, okay, girls just want to have, and finally one day she was responding. That's amazing to me. And not only that, I've just a little personal anecdote to share. My grandmother's brother, so my great uncle, was in a motorcycle accident, and he had to. It messed him up. He had to relearn how to walk, how to talk, how to feed himself, re-potty train himself. It was everything, but he remembered how to play a guitar. Now he's not great at it like he used to be, of course, because there are physical limitations to a brain injury like that. But when you watch him, you can tell that he knows what he's doing, and that's crazy, right? Because that's a way more complicated thing than talking or walking, in my opinion. Just to add to the funny story, we found out recently that my Uncle Rodney is friends or has been in correspondence with John Mayer. If anybody's familiar with John Mayer, who writes songs for him to learn on guitar to help him just kind of keep his brain going and doing all. Yeah, I was freaked out when I found out. But so that's not quite music therapy, but in a way it is. You know, he's giving him something to focus his brain power on, something to do and help him build that up. And it's not only his mental processes that he's building, but also his physical process. Exactly, his physical processes, because you know, playing a guitar, it's not the hardest thing in the world. If I can do it, anybody can do it. But it's also not easy. You gotta have some sort of dexterity, and it's just really great to know that music, in more ways than one, can impact somebody's life in a way that you wouldn't think it would unless you needed it to. Another situation I was in with school is I had a stroke victim client who very clearly could understand everything you were saying and attempt to speak, but she couldn't for whatever reason. She had just gotten too far into her old age and could not speak, and she would carry around a note with her that says, "I can hear, I can see, but I can't speak to you," you know. But we had her singing, by the end of the semester, "My body lies over the ocean." We had her singing that all the way through. Of course, it wasn't perfect, and she wasn't, you know, a world-class Grammy winner or something like that, but just the fact that we could get her to actually form words, and it was just great to me. And the coolest part is that after each session, she was able to like tell us, you know, "How are you feeling now?" "I feel good," you know. And it was very, very broken speech, but it was, you know, talking. And it's just so insane. A lot of people don't know the different kinds of things music can do for, you know, like your body, not just your brain and not just how you think and what you think, but your brain. I mean, your body, you know. So let's move on. Those are just a few cool stories. Who can benefit? That's a good transition. Just keep going down the list. This is a really short list. The actual list, if I were to actually give you a comprehensive one, we would be here for days. Because, and as it sums up at the end here, anyone can benefit from music, even if they don't have, if you consider any of these a problem. You know, even if you are totally normal, whatever that is, you know, you can benefit from listening to music, and in more ways than one. It's just the perfect medicine. We have autism, which I'm sure a lot of people have at least some experience with. Very common thing. Traumatic brain injury. I had a client who he was a victim of a traumatic brain injury. It was pretty great. He was a roadie for a blues band in the 80s. And they were on tour, and these guys wanted to steal their equipment, and he wouldn't let them, so they stomped his head in. Now he's in a wheelchair. He can still speak, but his the motion in the left side of his body isn't great. Very slurred speech and stuff like that. But he is so responsive to music that we were able to get him to lift his hands above his head, to move his arms around and play xylophones. I got him to play harmonica one time. He's just so motivated by music that, you know, even I don't want to say he was taken down a peg, because that's a bad way to put it, but he was. Life kind of kicked him in the butt a little bit, but through music he has just made such great strides. It's absolutely beautiful. Parkinson's, pretty self-explanatory. Instrument playing is very good for shaky digits or dexterity, walking. A lot of people with Parkinson's have issues with walking. That helps very, very much. Alzheimer's and other dementias. My clients last semester were both Alzheimer's or some type of dementia patient. And she was not, one in particular was not connected with reality at all. Didn't know her name, didn't know her own daughter, whenever her daughter came to visit while I was there. Didn't know what day it was, didn't know where she was, had no idea. But she knew the song "You Are My Sunshine" and could sing, which is great. I had to introduce myself to her every single week, but she always knew "You Are My Sunshine." Premature birth. This is another field that I'm sort of interested in the NIC unit. If you're familiar with the NIC unit, it's where children go if they're less than 6 months old and need to be hospitalized. So if they're born premature for whatever reason, have some sort of heart defect or any kind of defect, that's where they go. And music is very, very effective there. They invented this machine. Actually, it's called a PAL. And what it does, if babies are born too early, they don't know how to nurse on the mother. So this machine takes a sort of like a pacifier, and when the baby puts it in their mouth and is sucking on it, it plays music for them. So the baby learns that you get a reward from doing this, and eventually they use this machine to teach a baby who was born too early how to nurse. That's pretty cool. I think the lady who invented it actually was here last semester giving a talk at the school. Schizophrenia, that one's a tricky area, but again, music is really great for landing you in reality, which is a big problem for schizophrenic patients. Depression, anxiety, bipolar, I'm sure almost everyone has some sort of experience with something similar to one of these. Music is great. I mean, even if you don't want to call it clinical depression, you feel sad, what do? Listen to a sad song. Or listen to a happy song, you know. But if you have an actual therapist who is there making this happen for you, it can do a lot more work. Hospice patients, something I'm also sort of interested in, but I don't know if I can handle. Music is really great for creating, well, hospice patients have been given 6 months or less to live. And basically it's a keep them comfortable sort of situation. Music is really great for letting them connect with old memories, create new memories with their family, things for the family and them to remember, you know, after they have passed. It's really great for the families too, not just the patients. It's the same with premature birth. A lot of families need therapy. You know, you spend so much time looking at the baby and here's what's wrong with the baby. What about the parents? You know, they're going through, I don't even want to know what they're going through. I would rather never know about that, but you know, they need therapy, and a good way to connect with their child and get through all this is to use music as a sort of binding agent. And then of course everyone, like I said, I challenge somebody to think of a population that cannot be helped by music. It's really hard, you know. We even do therapy for people in comas who can't respond at all. People who are deaf, believe it or not. Okay, so it's a big question in the therapy field, and it's one I'm asked all the time, which is I understand it, but having to answer it so many times, it gets kind of repetitive. Why do you need a therapist? Why can't I just put on music and do all this, you know, myself, listening to my CD or my phone or Spotify, whatever people do now? Why is that necessary? You know, go ahead. There's just finish out the slide. Yeah, there's a lot of studies. I cited one in here, but there are so many of them that show that live music has a fundamentally different effect on the brain than recorded music does. I don't know why, because I'm not a researcher guy, but fundamentally your brain reacts to live music differently than it would listening to a CD. Even if we were playing the same song, your brain takes that in differently, which is really great. Not only that, a therapist can assess and adapt to a situation. If you're trying to do a relaxation exercise, which is what we'll be doing here in a little bit, and your client is agitated, they don't want to relax, they want to, you know, get angry at you for whatever it happens, a CD can't meet that need in the moment. All it can do is play and just like, okay, well, listen to this CD. A therapist can assess the situation, see like, okay, here's a problem, and then fix it. Not only that, well, I guess it ties into structuring interventions to greatest client benefit. If you're trying to do something, trying to do an activity with someone, and it's not quite working how you thought, happens all the time. It's not quite working the way you thought it would, you can adapt and change it a little bit to make it a little bit better. You can't do that with a CD or recorded music. No matter how hard you try, the best producers in the world could not do that with recorded music. Also, a therapeutic personality. If anybody is interested in the therapy field, you probably know about therapeutic personality. It's very important. Basically, just don't be a jerk. You know, sometimes CDs can't do that. Encouragement. We saw in the Gabby Gifford video when she starts getting frustrated and can't do. There's someone there who understands. I know, but I'm here to help you accomplish this goal. You know, unless you pre-recorded it, which would be crazy, crazy lucky magic, to say, okay, I know you're getting frustrated now. let's keep going. A CD is not going to keep you encouraged. At least it wouldn't for me. And I went over already about live music in your brain. It's just your brain just reacts differently no matter what. Biologically, you hear live music and it's just different. I could get into the science, but I don't want to talk about stuff I haven't researched recently. So we're gonna move on then. Okay, these are just some local organizations. These are all facilities that I've worked at through school. New Danville is an assisted living for mentally disabled adults. They have different levels of functioning, and my group was the lowest level of functioning. I had people age range from about early 20s, maybe even a little less, all the way up to 60 some odd years old. Most of them couldn't speak to you. They couldn't really do anything aside from react and answer yes or no questions. There was all kinds of different diagnoses, so it's not all the same type of patient, but we were able to socialize them and actually get them to interact with each other through music. They loved this activity where we would play music and they would kick a ball around, like a soccer ball, sit in a circle, and it was one of the only times I would see them, anyone in that group, make eye contact with another person and acknowledge the fact that, hey, somebody else is here, unless they were just given some kind of direct order. Creekside is a retirement facility, very nice retirement facility here in Huntsville that I was at last semester. I had a dementia patient, the one I told you about who could sing You Are My Sunshine, and also a patient who was a stroke victim. And while he was being medicated for the stroke, he had some kind of reaction to the medication and lost the ability to speak and move. Cognitively, he was there. You could tell. It was very, very clear because he would smile at you, and he wanted to respond, but he couldn't. But we got him moving his hand, and he really loved to dance with his wife. So we always had him dancing with his wife from music that they liked from back in the day. It was a lot of fun for him. Had a lot of smiles. Carriage Inn is another assisted living facility. That's the place that the traumatic brain injury client I had was at, and I'm going soon to visit him because he gets a music therapist every semester and absolutely loves it. Really, really great client. Aspire is where I am now. Behavioral health, short term. I see all kinds of people, all kinds, and I never know what I'm going to get before I get there. Even then, I don't get to read their files, or I don't have time to see what they're there for. I just know that they're in a behavioral facility. Don't know if they're there on their own or if they were forced to be there. I've had addicts. I've had just regular all kinds of mental issues. It's all kinds of stuff, and you never know. It keeps you on your toes, but we're able to socialize them and just provide a normalized experience with music. One guy I have a lot is really into Kenny Chesney, so I've been learning a lot of Kenny Chesney from my repertoire, which is not something that's usually there. And then the Music Therapy Center of Houston. Houston is great for music therapy, really great for it. All of the hospitals are starting to get going with the music therapy programs, and it's one of the most accessible cities for music therapy. This same Houston is one of the best schools in the nation for the program, and I think that can be owed a lot to the fact that Houston is very, very big on music therapy. And then for some reason we don't have my national organizations, but basically it's the American Music Therapy Association. It's just like any other field, we'll have a national kind of club, and they have another one for students, and that's where you can get money off textbooks and money off going to conferences and everything like that. So it's a lot of fun stuff. But they also put out the journal every month, which is a lot of great information. So that's the end of the presentation part of it, and I'm going to try something else after this. Might be a little weird to some of you, but we're going to do a relaxation exercise. Is anybody here at all stressed about anything? At all? If no, then I'm jealous. If you're okay, these next few minutes are all about you. Okay, I want to prepare you. You can get as comfortable as you want. Take your shoes off, lay on the floor. Do not care. Yeah. Feel free to fall asleep during this. It's fine. Whatever you want to do. Our goal here is to take away that stress for even just a little bit. Just a little bit. So we're going to do a little, it's called progressive muscle relaxation. Is anybody so afraid of the dark that they would be upset if I turned off this light? Anybody? No. You can fall asleep. That's actually the goal. If everyone falls asleep, that's okay. Someone open these blinds for me?
It's pretty outside. It is. It's wow. No, that's the it's done. Oh.
Okay, so while we do this, this is what's called a progressive muscle relaxation exercise. There's a little script that Ray here is nice enough to read for me. Like I said, this moment is about you. Don't feel like, if you think this is stupid and weird for whatever reason, you don't have to participate. You know, this is about getting away. For our goal here is to get you away from whatever is bothering you at the moment. So like I said, you can get as comfortable as you like, fall asleep, it's encouraged. We're gonna do this in just a second. Is everybody ready? Everyone comfortable? Get comfortable, do whatever.
All right, everybody, just listen what I say, do what I say, be perfect. Take a long, slow, deep breath in through your nose, all the way down into your stomach, and hold the breath for just a moment. Exhale through your mouth. Allow your breath to carry away all stress and tension as the air floods out of your lungs. Take another slow breath in through your nose, fill your lungs completely, and hold it for a moment. Release through the breath of your mouth. Empty your lungs completely and feel the tension in your body melt away. Go ahead and take a third deep breath in. Hold it for a moment and let it go. Feel your body has already undergone a change. The tension in your body has begun to loosen and subside. Now, let your breathing rhythm return to normal and just relax. Bring your awareness to your feet and toes. Breathe in deeply through your nose, and as you do, gradually curl your toes down and tense the muscles in the soles of your feet. And hold your breath for just a few seconds. Now release. Feel the tension in your feet wash away as you exhale. Notice how different your feet feel when tense and when they are relaxed. Feel yourself relaxing more and more deeply with each breath. Your whole body is becoming heavier, softer, and more relaxed as each moment passes. Now, bring your awareness to your lower legs, your calf muscles specifically. As you draw in a nice deep breath, point your toes up towards your knees and tighten these muscles. Hold it for just a moment, and then let those muscles go, limp as you exhale. In a moment, you will tense the muscles in the front of your thighs. muscles pulling your kneecaps upwards. If you are seated, you can tense these muscles by pushing your heels down onto the floor. Now, take a deep breath in and tense the muscles in your thighs. Hold it for a moment, and then release everything. As you do this, the blood flow to your muscles will increase, and you may notice a warm, tingling sensation. Enjoy this feeling of soothing relaxation in your thighs. Focus on letting your muscles go limp and loose. Draw in a nice deep breath and gradually tighten the muscles in your glutes this time. Hold this contraction for a few seconds. And then release your breath. Feel the tension leaving your muscles and feel them relaxing completely. Now, take another breath, and this time gradually tighten all the muscles in your legs, from your feet to the small of your back. Do so in whatever way feels natural and comfortable to you. And then hold it. Now release. Enjoy the sensation of release as you become even more relaxed with each breath. Now, bring your awareness to your stomach. Draw in a nice, deep breath and tighten these muscles in your abdomen. Imagine you're trying to touch your belly button to your spine. And now release your breath and let your muscles relax. Notice the sensation of relief that comes from letting go. Bring your awareness to the muscles in your back now. As you slowly breathe in, arch your back slightly and tighten these muscles. Now release your breath and let your muscles relax. I'm going to give your attention to your shoulder muscles and the muscles in your neck this time. As you slowly draw in a nice deep breath, pull your shoulders up towards your ears and squeeze these muscles firmly. Muscles to go loose and limp. Feel the tension subside as you relax and breathe out. Feel the heaviness in your body now. Enjoy the feeling. Feel yourself becoming heavier and heavier. Feel yourself becoming more and more deeply relaxed. You are calm, secure, and at peace. Now, it's time to let go of all the tension in your arms and hands. We'll start with the upper arms. As you breathe in, raise your wrists towards your shoulders and tighten the muscles in your upper arms. Hold that breath and that contraction for just a moment. And then gently lower your arms and breathe all the way out. You may feel a warm, burning sensation in your muscles when you tighten them. Feel how relaxing it is to release that tightness and to breathe away all tension. Bring your awareness to your forearms. As you breathe in, curl your hands inwards as though you were trying to touch the inside of your elbows with your fingertips. Now feel the tension subside as you relax and breathe out. Feel it wash away. Take another breath in and tightly clench your fists. When you have finished breathing in, hold for just a few seconds. And release. Notice any feelings of buzzing or throbbing. Your hands are becoming very soft and relaxed. Let your fingers go limp. Your arms and hands are feeling heavy and relaxed. Take a couple of nice, long, slow breaths now and just relax. Feel yourself slipping even deeper into a state of complete rest. Now, tighten the muscles in your face by squeezing your eyes shut and clenching your lips together. As you do, breathe in fully facial muscles. Feel your face softening. Bring your awareness to the muscles in your jaw. Take a deep breath in, and then open your mouth as wide as you can. Feel your jaw muscles stretching and tightening. Now exhale, and allow your mouth to gently close. You are now completely relaxed, from the tips of your toes to the top of your head. Please, take a few more minutes to rest. Relax, listen to the music and the sound of your breathing. Enjoy the lovely warm sensation of physical relaxation. If you have the time, feel free to fall asleep. When you are ready, sit up and return to the world. Until then, this moment is about you. Enjoy it however you please.
Everybody feel okay? Y'all still with me? I'll give it a second. I'm gonna turn the lights on in a minute, but I don't want to destroy anybody's eyeballs. Does everybody feel good? Is that cool? That's pretty cool, right?
I heard you like running cameras.
Does anybody want to share like what they liked, what they didn't like, what worked, what didn't work about what just happened there? Anything?
Presentation or that last one?
The last little part.
I fell asleep. Yeah.
Did anybody fall asleep? Yeah, I didn't want to cut you off, but you know, I can't keep everybody here all day. Yeah, that's the point. So basically, I had to think of something to have to demonstrate music therapy in some way, and what better way to a group of stressed out college students than to have them do nothing but chill out for a few minutes, right? So that's pretty much all I got. Does anybody have any questions or comments or anything for me?
Okay, so I know you said like y'all usually work in hospitals and stuff. I don't know if this is too personal of a question, but do y'all get paid pretty good?
This is a fair question. I think actually now that I think about it, we miss a slide about all the places you can work, but it really depends on where you're at. My plan personally is to try and establish a program somewhere, maybe in a school or in a behavioral health center. And while I'm establishing that program, do a private practice on the side. So, I mean, if I'm running 2 jobs at once, I would be getting paid pretty good. The range of music therapists, and I believe 2015 was anywhere from 20,000 to 200,000 in salary. And of course, there's an average in the middle of there, and that's just like the sweetest gig you can get. But yeah, I mean, it pays the bills, you know. And I think it's a fun job. That's fun to do. Like I said, it depends on where you work. A lot of my professors here, they you know, teach here, do all that stuff here, but also run a private practice on the side. So I don't know for sure, but they're probably doing pretty well for themselves. Our grad assistant, Marcus, who runs the clinic over in AB1, he's also a massage therapist. So he works here as a massage therapist and runs a private practice as well. So you can do all kinds of stuff with it. It just really comes down to what you want your day-to-day job to be. You know, it's very open, very, very open. It's a good question. I like questions. Anything else? Did anybody not enjoy the relaxation? Did anybody think that was weird and dumb at all? No? Okay, good. Good. It's okay if you did. It's okay. Well, I guess that wraps it up. Nobody has anything else to say. I have a little bit of information up here for just the program at school. Don't have a whole lot of those in these little cards here. You can grab one if you want. And also please do these things that if anybody didn't get one, raise your hand so I can give you one. I need those for my class. And be brutally honest if you must. Yeah.